I would like to explain peptic ulcer disease and its causes, symptoms, and treatment. Peptic ulcer disease is a mucosal ulcerative lesions of stomach and duodenum. So, mucous layer got wound or hole or lesions in the stomach and duodenum part. So, if the ulcer formed in the stomach is called as gastric ulcer. If it is formed in the duodenum, it's called duodenal ulcer. So, it is believed that the ulcer, peptic ulcer disease occur when gastroduodenal mucosal layer defenses are unable to protect the epithelium from the corrosive effect of acid and pepsin. So when the mucosal layer unable to protect itself from the acids and pepsin. So this peptic ulcer disease, that peptic refers to the pepsin enzyme which breaks down the proteins. And the ulcer, peptic ulcer, that word refers to occurs when linen is corroded by acids, hydrochloric acids. H. pylori infection and NSAIDs are important risk factors for peptic ulcers. You can see this image showing the stomach or gastric part showing the ulcer or hole or wound. We can call it as wound or hole or ulcer. So this is the gastric ulcer since it is there in the stomach. You can see the another part, duodenum, having the ulcer. It is a duodenal ulcer. This is the enlarged view of this ulcer. The causes of peptic ulcer disease is ultimately excessive secretion of gastric acid, hydrochloric acid secretion in excess that leads to the very acidic pH. So the pH of stomach between 3 to 5, but in this case of acidity condition, very acidic, that is nearly 1, around 1, which is causing the damage to the gastric mucosa. Then inadequate protection of lining of the stomach and duodenum against digestion by acid and pepsin, followed by Helicobacter pylori infection. So this Helicobacter pylori is very important in this case of peptic ulcer disease, since this is the main cause for the disease. So this Helicobacter pylori will secretes or excrete enzyme called urease, so which convert the urea into ammonia and bicarbonate. So the conversion of the urea into ammonia, this ammonia is very toxic. So this toxic ammonia will cause the erosion of the GI lumen or gastric mucosa. So Helicobacter is majorly important factor in the peptic ulcer disease. The another important factor is the NSAIDs drugs, non-steroidal anti-inflammatory drugs, and also some corticosteroids which is used for pain management. So these NSAIDs cause ulcerative problems due to the interference with prostaglandins and preventing the prostaglandin 2 synthesis. So if the prostaglandins are normally there in the stomach, which will decrease the hydrochloric acid secretions. So ultimately the damage will be reduced. If the prostaglandins are not there and this NSAID is preventing the prostaglandin synthesis, so by the time the HCl secretion is more, damage of the mucosa will be more. Then also this prostaglandin will produce the bicarbonates more. Bicarbonates more. This carbonate or carbon will bind with the acids and pepsins. It will protect the mucosa and also it will create the pH from 1 to 2 to 6 to 7. So this acidic, very severe acidic pH will be converted into neutral, more than neutral pH, nearly alkali pH, alkaline pH 6 to 7. That will make protection against the peptic ulcer disease. Symptoms of the peptic ulcer disease includes Epigastric pain, which comes 90 minutes to 3 hours after eating. So this is the most frequent symptom. This pain comes at 90 minutes to 3 hours after meal. So these are the common symptoms observed in the peptic ulcer disease. So other symptoms that includes right upper quadrant pain, abdominal fullness, nausea and vomiting, then weight changes, fatigue, bloating, chest pain, burning, heartburn, constipation. So diagnosis of peptic ulcer disease that includes clinical identification plus endoscopic examination. Then the test for H. pylori also important. So H. pylori can be detected with the serological test, antigen antibody based test, and also with the urease test and histological examination, and also with culture sensitivity test, antimicrobial test. That means culture sensitivity test. So this urease test can be performed. The name is urea breath test. Urea breath test. You know the higher pyrrole excrete the enzyme urease, right? So this will convert the urea into ammonia and bicarbonate. So during this diagnostic test, there is a release of carbon, right? This is a bicarbonate will produce the carbon. This carbon will be carried out by blood. This blood carries the carbon to the lungs. The carbon can be detected in the patient breath. So when the patient breathes after this test, so we can detect this presence of carbon from the exhaled air. So the patient need to drink the urease enzyme before performing the test. So this urease enzyme will not urease enzyme. We need to drink the urea solution that will make the test positive or negative. But for diagnosis very clear, for diagnosing the H. pylori very clear, we need to go with serological test. So serological test will detect the H. pylori and confirm it very easily. So treatment can be categorized into peptic ulcer disease only and also peptic ulcer disease associated with H. pylori. So first we will see the peptic ulcer disease only. So there are certain drugs recommended for peptic ulcer disease, which all are proton pump inhibitors and 5-HT receptor antagonist. So this is the ranitidine, cimetidine, famotidine, omeprazole, esomeprazole, pantoprazole, rabeprazole. So these are the commonly prescribed drug for peptic ulcer diseases without H. pylori infection, with no H. pylori infection. So ranitidine, the dose is 150 mg orally twice a day or 300 mg at bedtime about 4 to 6 weeks. So once it is getting treated, we may maintain the therapy with 150 mg at bedtime, or we may go with alternatives cimetidine 400 mg orally twice a day with breakfast and the night, or 800 mg at night for 4 to 6 weeks. In this case of gastric ulcer, we may look at 6 weeks of 400 mg twice a day treatment. For children, IV or oral, about 20 to 40 milligram per kg per day. Neonates 10 to 20 mg per kg in 4 divided doses. So other alternatives are famotidine 40 mg oral at night 4 to 6 weeks. Omeprazole 20 mg oral 4 times a day for 4 weeks for duodenal ulcer, for 8 weeks for gastric ulcer. Esomeprazole orally 20 mg daily for 4 weeks, or pantoprazole 40 mg orally twice a day for 4 weeks, or rabeprazole orally 20 mg daily for 4 weeks. If the peptic ulcer disease with H. pylori infection, we need to go with the following treatment. So we may include two antibiotics plus some proton pump inhibitors such as omeprazole, rabeprazole, pantoprazole, whatever we need, we may combine. So the treatment includes amoxicillin 1 gram orally twice a day plus clarithromycin 500 mg orally twice a day plus omeprazole 20 mg orally twice a day for everything, that these three combination for 7 to 14 days. 7 to 14 days. 2 weeks treatment should be necessary. Alternatives are amoxicillin 1 gram orally twice a day plus metronidazole 500 mg orally twice a day plus omeprazole 20 mg orally twice a day for 7 to 14 days. So we may have amoxicillin, proton pump inhibitor, either clarithromycin or metronidazole. So amoxicillin plus proton pump inhibitors plus clarithromycin or metronidazole for the treatment of peptic ulcer disease. Thank you.